gonna move some of your beautiful faces so I can see my slides. There we go. So today I'm going to try to get through these slides fairly quickly so that we have plenty of time for questions, because I think the questions are probably where we get to explore some future directions more than in a presentation. So thank you again, Jeff, for inviting me. Thanks to the MMX community for including me on in your evening here. And so without further ado, sex, drugs, and not rock and roll, but COVID-19. Let's see if we can make it. Yep. So we're going to start by talking about just sex in general. Like what is,
I don't know if it's me, but what is sex? I'm losing a reception.
Okay.
We hear you fine, so it must be on your end, whoever just said that. So sorry about that.
Got it. So we'll talk about sex during COVID-19 and safety, choosing your partner, choosing how you play, keeping on top of your sexual health. And we'll probably explore that in questions even more. And then just an aside, because sometimes drugs go with sex, talking about partying safe. So I think it begins with just the straight up situation of what we have with COVID-19, because COVID-19 spreads pretty easily. And sex during this pandemic can be risky because of how it spreads. So mainly close contact with someone who has the virus is how this spreads. And that is within 6 feet. And I think most sex, not all, would involve you being at least 6 feet, less than 6 feet from each other. It spreads through respiratory droplets, spit. There's some possibility of fecal virus in feces, and that being a way of transmission. Additionally, there has been some data about COVID-19 in semen. So although other coronaviruses aren't easily spread through semen or vaginal fluids, we don't know everything about COVID-19. And because the virus can spread by people who have no symptoms, it really is during this part of the pandemic, you sort of have to assume that every sex partner could potentially have been exposed to or have COVID-19. But even with all of that bleak news, there are ways that you can, in fact, reduce your risk. My favorite, our sort of line that made it all the way to Saturday Night Live, is that we remind New Yorkers that you yourself are your safest sex partner. I think that we know for a fact that masturbation will not spread COVID-19. Neither will sex toys, as long as you wash them with soap and water before and after sex. Also, though it's spelled wrong, virtual sex will keep you safe. And so as we sit here on this Zoom, clearly we're in a different space with a lecture, but really virtual strategies, including FaceTime, there it is, FaceTime, et cetera, definitely are sort of strategies to try to make it sexy, but still prevent potential transmission of COVID-19. Again, I'm sorry for the misspelled virtual. So in general, your partners that are the safest from the perspective of COVID-19 to have sex with are those that live in your household. So you're already exposed to them all the time. And so that means that that you're in close contact, and sex and intimacy is just another sort of level of close contact. In general, the not so much harm reduction, but the sort of clearest way to prevent transmission is to avoid close contact, including sex, with anyone outside of your household. Now, realizing that that's not always possible, there are other things that you can do. And one of them is to limit your number of sex partners. Also, if you have folks that you can, quote, trust, which means that you can have a frank conversation. And by trust, I mean people that you can talk honestly about, to see if they've recently had COVID-19 symptoms and really how they've been doing with practicing their own physical distancing, including other hookups that they have had with other people. So really having frank conversations, not only about the things we usually have frank conversations about, but also about COVID-19. And also, again, this is, I think, my second sex talk, and my first was with people who are sex workers. So this is a very challenging time for individuals who are making who are using sex to make their living. So again, it goes back to consider breaks from in-person dates, try video dates, sexting or chat rooms, or like every single one of my friends get an OnlyFans. So I think that that is a really sort of common strategy, not the most appealing, but really this is at least the beginning of a harm reduction strategy, which we'll get deeper into when we get to questions. So group sex. So large gatherings of any type are unsafe during COVID-19. So sex parties specifically means lots of close contact with lots of people, and if possible, should be avoided. Again, that's not exactly the sexiest thing I've ever said, but from the perspective of like of groups are a very efficient way of transmission. So ideally, these should be kept to a minimum. So this is where you may want to think about either limiting the number to the group to just a few, or potentially trying to sort of go one-on-one for a while, especially during this. Again, the more exposures you have, the more potential there is for transmission. So how do you play? So avoid kissing anyone who's not part of your small circle of close contact. So people who are your potential, either people in your household or folks that you are consistently hooking up with. Avoiding rimming right now is probably a reasonable thing, since there is evidence of virus in feces. So it can enter your mouth. We don't know if that's a very efficient mechanism of transmission. There are data from the other SARS-1, that there could be some fecal oral transmission, but again, it's not a slam dunk for COVID-19. Other things that you can do to create a barrier during oral or anal sex, like condoms or dental dams, may reduce transmission from the perspective of like those fluids. Additionally, washing up before and after sex is now more important than ever. So again, really good hand hygiene with soap and water for 20 seconds. Sex toys being washed with soap and warm water, which is always good advice. And then if you're using other strategies to get off, like keyboards or touch screens, you may want to think about giving them a little bit of some disinfectant, a little like Lysol or something like that to wipe them down, or something alcohol-based to clean the keyboard. It's really important to remember that though people who are asymptomatic may spread COVID-19, symptomatic folks definitely are at risk for spreading. So if you or your partner have any COVID-19 symptoms, no matter how mild, avoid sex, and especially kissing. So please note, you can be a little creative with that. So there's ways to have sex without kissing. And that's what masks are for. So there are other ways to do it. So bringing a whole new meaning to mask for mask, really. So you'll figure out like some new strategies to prevent droplet secretions while not potentially preventing other exchanges of fluid. So common symptoms are fever, cough, shortness of breath, chills, sore throat, muscle pain, and then something that we really have seen a lot of is loss of taste or smell. So people say they can't taste or smell as well. Then there's also some gastrointestinal symptoms like nausea, vomiting, and diarrhea, but those are less common. So then another important thing to remember is really that the same advice doesn't necessarily go for everybody. And as we get deeper into this pandemic, we may be sort of emphasizing this point even more. So if you or your partner has a medical condition that can lead to more severe COVID-19, consider taking more precautions or even skipping sex. So what I predict is going to happen as we get to a different phase of transmission, when there's lower transmission in New York City. We're getting there. We're not quite there yet. Like, I think our guidance will change a bit. And that guidance will be around what's called cocooning. So preventing transmission and exposure for people who are at specific risk, which means that guidance for people who do not have those specific risks will probably go down a bit. But remember, what we're doing now is not necessarily preventing disease in one person. What we're trying to do is prevent community spread of disease and preventing those surges in healthcare. It's that flattening the curve idea. So really, we're in that zone still with the level of transmission that in general, trying to be a little bit more ginger with settings that could lead to transmission is critical. Now, what I talk about, the cocooning idea, is that eventually we're going to get to the point that says that certain people may need to sort of hold back, not just about sex, but also about going out and about, wearing masks, et cetera, because of their own personal risk for worse outcomes with COVID. Those diseases include lung disease, heart disease, that includes high blood pressure, kidney disease, liver disease, diabetes, obesity, cancer, and a weakened immune system. And so specifically having unsuppressed HIV and a low T cell count. So again, not everybody with HIV is at equal risk. People who have more severe immunocompromise are at higher risk. So also, it's important to remember that that sometimes when you're trapped at home, we give advice about only having sex with people in your household. Obviously, that means partners that are consensual. So sexual activity without consent is not okay. It's considered rape or sexual assault. I don't have to tell you all that, but I just want to sort of put it out there because that was actually some confusion in our guidance when it first came out. To learn more about consent, you can visit our website all about that. Also, this is a time during COVID-19 where we've seen surges in domestic violence. And so it's really important that we sort of consciously make sure that we hear about our friends and our family to make sure that they're safe in their relationships. So we have a lot of resources that are also on this webpage in case you want to look deeper into those areas. It's also important to keep on top of your sexual health. So call your provider if you have symptoms of an STI or think you may have been exposed. Also, you may have been exposed to HIV or need HIV pre-exposure prophylaxis. So all of those things still continue on. I'll also say then we can have more conversations about this during the Q&A. A long time of near abstinence for many people provides a really interesting opportunity when healthcare reopens to actually get tested for HIV and STIs and see if we can actually work to eradicate some of them. So because transmission of those infections may have been decreased during this time of pause, we may have a shot at actually making a bigger impact on what's happening in New York City and in our personal health from the STI perspective. Now, for people who are living with HIV, keep taking your HIV meds. So I have a nice cohort of people living with HIV who I see in my practice who aren't able to come to care right now, but that doesn't mean they're not getting care. So through my patient portal and through texts and telephone calls, all of them are maintaining their medicines. It's important for a lot of reasons. It keeps you healthy. And also, remember, I'm actually wearing my U=U shirt. It prevents you from spreading HIV to your sex partners. And there is increasing data that individuals who have suppressed viral load living with HIV are likely at lower risk for complications of COVID-19. So lots of reasons to stay on your medicines. Also remember that pharmacies are essential services, so they are still around to buy condoms, lube, prescriptions, and many of them deliver. And also remember, just because you can't go to care because the doctor's not open, there's sort of there are telemedicine options that may allow you to make sure that you're continuing on your medications. So if you have trouble finding a provider, there's a whole list there of how you can do it, including dialing 311. Additionally, I really want to make a big plug for, thank God we already had it, our 24-hour, 7-day-a-week New York City post-exposure prophylaxis hotline. So if someone is worried about an exposure who's HIV negative and they're worried about being exposed to HIV, our PEP hotline has now shifted to giving a full supply of post-exposure prophylaxis. So dial 844-4PEP-NYC, and that gives you a way to start post-exposure prophylaxis, and I believe even through delivery pharmacies. So really designed to try to make this as easy as we can during this tough period. Also, talking about partying, if you're going to gather, bring your own. So that means bring your own food, your drinks, drugs, and drug equipment. I had a friend who called me and said, oh, I had a nice day. I was socially distanced. We went to Central Park and somebody had some ketamine and I used their bumper. And I was like, well, that's not so much for, physical distancing if you're shoving something up your nose that went into someone else's nose. So just think ahead, think about partying smart and making sure that you have appropriate drug equipment and drugs of your own. Always use a face covering when you can. So if you're going to be in a group, make sure you do. Hand sanitizer is your friend. Wash your hands with soap and water often. And if you feel uncomfortable, and I think it's like, unfortunately, a little bit of the new normal now, that if you're in a place where you just don't feel like you have enough space, it's okay to leave that space. So it's good to feel comfortable. Additionally, like even though you are partying and you should enjoy your life, limit how much alcohol and drugs you do so you can stay in control, so you can maintain some of your strategy for preventing COVID. Don't share drinks with others. Don't share cigarettes, blunts, pipes, vape pens, or any other drug use equipment. And remember that a lot of drugs in New York City that are supposed to be cocaine or ketamine or other things also have fentanyl in it. So if you haven't learned about naloxone, please carry naloxone. You're allowed to get that without a doctor's prescription. So really important to remember that for partying smart. So in terms of safer drug use, wipe down drug packaging, supplies, and services before use. Don't use alone. And if you do, there's a never use alone hotline before using that helps support you. It's important to think about overdose, especially because of what I told you about with fentanyl and some of the drugs. And if you're using syringes, whether it be for opioids or for other stimulants, remember that there's ways to get unused syringes through syringe services program. So if you do inject, avoid sharing works, prepare and administer your own injection, and very important, although seemingly obvious, do not lick the needle before you use it. So we have a lot of resources, including our Safer Sex During COVID-19 guide, which will ever be evolving, and then just other guidance that is specific to COVID-19. And with that, I think I am ready for the most important part of this, which is going to be questions.
Do you want to take your sharing off so we can go back?
Yeah, sorry.
Grid view.
I am stopping sharing. It's gone.
And did you want to take some of the questions that were sent in?
Sure, I'll do whatever you want. If you want to read me a question, I'm happy to answer it, or we can open the floor, whatever works.
Okay, we'll start with a few that were sent in. Okay. How do I most effectively create connections, both in-person, platonic, and sexual romantic, when we're all afraid to meet in person / hook up due to COVID spread potential?
Great question. I think the answer is going to change over time. I think where we are right now in the pandemic, I encourage you to use media such as this one, such as FaceTime. I mean, I know for myself, I've been making FaceTime appointments